My name is Chris Starr. I am an associate professor of ophthalmology, a cornea ocular surface specialist at Weill Cornell Medicine in New York City. Some people view dry eye as something that is not exciting, maybe a little boring, or there's nothing new in the area. And I would argue the complete opposite. It's a phenomenally engaging subspecialty of ophthalmology, and dry eye, and in particular ocular surface disease. The term I like to use, dry eye, is just one component of the ocular surface disease and dysfunction. And so in Cornea Day at ASCRS this year, we had two sessions. One was called severe ocular surface disease, which got into things like severe limbal stem cell deficiency, neurotrophic keratitis, corneal melts, and things like that. And so we called our session, Priya Gupta and I were the two co-moderators here, less severe dry eye, or less severe ocular surface disease. And so we did cover more of the day-to-day in-office dry eye patients, which, let's face it, it's the most common diagnosis any ophthalmologist sees on a day-to-day basis. So MGD, the pipeline treatments, the new treatments, this is why this area is exciting. Every year we have all these new approvals, all these new devices, all these new diagnostic tools, all these new treatments. And so I'll always argue, and have been arguing for a few years now, that this is a subspecialty of ophthalmology unto itself. It's not cornea anymore. It's not general ophthalmology. It is ocular surface disease, and it deserves its own subspecialty. The thing that I find to be, and I have a paper here that one of my research students is presenting on, and what we showed in my practice at Weill Cornell, in an academic center, tertiary referral center, of all the ocular surface patients who have come to see, or dry eye, and I always put it in quotes, of the dry eye patients who come to see me, and if they have seen two or more dry eye doctors prior to seeing me, the diagnosis of neuropathic corneal pain was diagnosed in about 90% of those patients. So this is something that even experts in ocular surface and dry eye still miss every single day. Neuropathic corneal pain is tremendously important. It is one of the most, and it really is a severe form of ocular surface disease, because this condition drives people to commit suicide in some cases. It wrecks quality of life. It is so intense for so many patients that failing to diagnose it and failing to treat it is a tremendous disservice to our patients. And so that is something, if there is one take-home measure from our session today, it is always be thinking about the corneal nerves, and in particular, neuropathic corneal pain. Look for it, especially if your patient in front of you has seen multiple other doctors, has been treated with this laundry list of dry eye drops, and they're still suffering. Reproxalap, which is a unique and novel anti-inflammatory and oxidative stress, anti-inflammatory that works upstream in the inflammatory cascade, above steroids, above immunomodulators, above NSAIDs, has been in development for several years. Full disclosure, I've been a consultant with Reproxalap and AbbVie with this product. And it has had some FDA troubles, I guess would be the word, and it's been rejected by the FDA in various forms over the years. I don't think it's fully dead in the water at this point. We're still working on it, but that was the thing that I was 100% most looking forward to, hopefully having this year. In fact, we were hoping that it would be FDA approved before this meeting, and we'd be talking about it here. I have a long list of patients who I think would do very well with Reproxalap. They've been told about it for probably the last few years. I'm like, this thing is coming, it's coming. And it's still not here. So that is the thing I'm most excited for, and I'm hoping that it gets through the finish line at some point soon. The other thing that I'm looking forward to is the Okio company is working on a product that will hopefully be FDA approved for corneal neuropathic pain that I was just talking about. The data looks really good for that, really promising. We don't have anything FDA approved for it. It can be a tricky disease to treat adequately, especially when it's central neuropathic pain. But for peripheral neuropathic pain, it's a little bit easier because drops are more amenable to that condition. And this or Fosamed, which is the compound, the data looks very promising, and I'm hoping that that gets approved this year as well.